from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about treating pediatric patients effectively. Our first guest today is Carrie Hogue, the Pediatric Emergency Care Coordinator at the SMH Sarasota campus. Carrie, thank you for joining us today.
Thank you for having me. I'm excited to be here.
So when a child comes into the emergency department, what are some of the unique considerations involved in caring for pediatric patients compared to their adult counterparts?
So we have to look at kids as their own identity. They are not small adults. We have to be prepared for everything that is going to make them do better. We're worried about not just how they're doing physically with what they came in with, but we also think about their emotions, how scary a place like the ER is for the children. We want to make sure we make the visit something that they're not going to be terrified to do again. We don't want them scared to come back. We want them to have good, memorable items when they show up in our ER.
So what does pediatric readiness mean, and what does it take to make sure an ER is truly prepared to take care of children of all ages?
So pediatric readiness means that we have to have everything ready for any scenario of any age, from newborn to the older teenagers. All of our equipment should be ready for every size that we need. All of our staff has gone through scenario simulations for different types of emergencies, so it's always a familiar thing for them. We make sure all of our policies, procedures are up to date with the newest evidence-based practice, and we compare everything with the PECs all across Florida to make sure that we're all doing similar items and we're all up to date.
Yeah, the equipment is a big piece because not a lot of people think about the huge range of
A
sizes.
lot of sizes.
So a lot of that pediatric readiness does happen behind the scenes. What are some of the ways the team prepares for a child ever coming through the ER doors?
So we have monthly simulations where we do different pediatric events, like we can have drownings, or we can have, as far as just needing antibiotics, every month it's going to be something different. We also have the neonatologist and OB team. They put together a precipitous birth, so we're ready for even a baby that's freshly born, whether it be in our parking lot or in one of our beds before they can make it up to OB. There's always some kind of training going on and education being handed out to make sure everybody is on board with what they need to do when the event happens.
I want to talk a little bit about your role as a Pediatric Emergency Care Coordinator, or PEC. How does that position help ensure children receive the best possible care?
So being the PEC is a great job. We get to collaborate with everybody, like I said, all the other PECs in Florida. We have meetings. Laura and I in Venice have multiple meetings so that we're doing things across the board together, but we're also in all kinds of educations from Texas to Denver. We get information everywhere on how to better train our staff and do the best we can do for children. Here recently, we were able to set up new pediatric rooms, or anytime we find a gap where we need to do better, it's kind of the PEC's job to figure out how to do better and what we need to do to make it happen. Even if it's little things on making sure that we have extra stuffed animals to help to show kids how to do some procedural things so they're not so scared of it.
And you work with a role that I want to talk about a little bit called a child life specialist. So what does a child life specialist do, and how does that play a role in helping children and families through what can be a very stressful experience?
So Jenna, our child life specialist, is a very unique role. Many hospitals don't have one at all. It's a rare job. She works the entire hospital for anywhere a child might be, whether it be OR or a child that's parent is in the ICU. She helps them in a way that they can understand at their level of what is going on. She will step through and do each process, whether it be an IV or a massive surgery. She goes through it and is able to talk to them. She's also kind of our moral compass to make sure that we're doing things in a way that is not traumatizing or scary for kids. She really just pushes us to always do better and think about the entire child instead of the medical problem.
Makes a lot of sense. How does Sarasota Memorial collaborate with pediatric emergency medicine experts to ensure the practices remain evidence-based and align with current pediatric standards?
So we have quarterly meetings with all of Florida EMS. So we're in line with all of the paramedics and emergency workers outside of hospital. We have monthly meetings with the PECs that are all across Florida. So we also have a PEC doctor, Dr. Ruffin, who meets with us and goes over the newest technology and evidence-based practice. It's in the medical world that we may not have heard of yet, and helps us with getting the policies and procedures and the new order sets for children.
An emergency department can be really overwhelming for a child. It could be overwhelming for an adult, but for a child. So what have you done at the Sarasota campus to create a more welcoming and less intimidating environment?
Yeah, so we've made some rooms that are specific for pediatrics. They each have a theme, and they're cute little rooms to make them feel more comfortable. We give gifts to calm them. We have brought in better, less intimidating items. So we would use different types of procedures that are just easier on them without bringing needles involved, and whatever we can do to make them feel more comfortable. And we have things to keep them busy when they're sitting, instead of sitting there anxious. We have Game Boys. We have different toys for them to play with, distraction techniques for a lot of the kids.
I want to talk about those pediatric-friendly treatment rooms. There are 4 of them, correct?
There are 4 of them.
How can something as simple as a safari theme or an ocean theme or space or jungle make a difference to a child?
It lets them know that they're welcome there. It's a friendly place for them. It looks like a nursery. Even our adults love being in those rooms. There's always something to look at. Each room has its own theme. We have the safari, jungle, outer space, and under the sea. They each have their own coloring books designated for that room. So as soon as a child goes in there, they get a coloring book and a sticker book that matches their room, and they can play their own games of find this and that. There's also Band-Aids that match each of those rooms. So in that room, if you're in outer space room, you're going to get an outer space Band-Aid to cover things, even if they don't need it. For in the kid's mind, Band-Aids fix everything, and they're fun little stickers to put on themselves. So it just makes them feel more welcome that this room is made for them.
Can you talk a little bit about the gaming system, Disney iPads, distraction toys, and how they can help them in an unfamiliar environment?
Yeah, so the distraction's one of the biggest things, because for kids it's the unknown of what we're doing. We can explain to them what they're doing, but they're not going to fully understand it. Sometimes they don't even notice what we're doing if they're busy doing something else. So if you put a game on or you put a movie that they really like, it gets them really focused on that, and they're not focusing on the pain, where we can work around with it.
And pediatric readiness at Sarasota campus starts from the moment they walk in the doors. There's even a waiting area, correct?
So the waiting area has a little game area. It's where all the children, they're not going to be surrounded by adults that might scare them from their medical concerns. And it's a great place for us to be able to just walk by and see what's going on and lay eyes on children even before they're triaged.
Makes a lot of sense. And the pediatric resources extend beyond the emergency care center at the Sarasota campus. So what does it mean to have an inpatient pediatric unit available for children who do need to be hospitalized?
It's wonderful. It's really nice. I love it just for our families alone, because to drive anywhere where there's a children's hospital is quite a drive. So we're able to just continue the care. The doctors that are working up in the pediatric floor will come down, and they'll see them while they're in the ER. So it's already a familiar face. Our pediatric intervention do the same. They will be down in the ER and then follow them up to the floor. And sometimes that familiar face between transitions is what's really needed. They already know something. They know what's going on. It makes them feel safer.
There is 24-hour pediatric physician coverage through a partnership with Johns Hopkins All Children's Hospital. So how does that around-the-clock access to pediatric expertise support what your team is already doing?
Oh, it heavily supports. We can gives us access to a lot of their policies, procedures. They, of course, are the experts in children because that's all they do. So we can really bounce things off of them to find out what they're doing up at All Children's Hospital and go back and forth and get ideas to how we can better ours to match them. There
is also a pediatric intervention nurse available 24 hours a day. What does that specialized support look like for children, families, and the clinical team too?
Yeah, they're great. They're probably one of the most favorite people in the entire ER. Our pediatric intervention nurses, they go anywhere children go as well, any place they might be in need, but they are the experts in their fields. Like if we have any questions, if we have some nurses that don't feel quite comfortable with peds, they can call them and they will come down and walk them through a procedure or do it with them to get them to feel more comfortable. But they have extensive experience in pediatrics and they kind of know their game, and it's really helpful. Sometimes they just are there for moral support because they've already helped us grow so much. They decide whether we need their help or not, but they'll be there for whatever we need.
So when you look at everything that goes into pediatric readiness, from specialized expertise in education, child-friendly spaces, emotional support, what are you most proud of at the Sarasota campus?
I'm most proud of just the growth. Like we're no longer Sleepy Sarasota. It's not a retirement community. Families are moving in so quickly, and Sarasota Memorial is they've upped their game and decided this is something that's important to us. We need to better our pediatric healthcare, and it's moving very fast. It's so fast it's hard to keep up with sometimes, but it is growing and everybody's getting buy-in on it. They all want to do better for our pediatric population. When we do our pediatric simulations, they get to do things that in a controlled environment where they can learn and grow and make them feel more comfortable, and because they all know that we're getting more and more children every day. So I just love the growth and how we're growing with the community.
Thank you so much, Carrie. Our next guest today is Laura Robinson, who is the Pediatric Emergency Care Coordinator at the Venice campus for Sarasota Memorial. Laura, thank you for joining in this discussion.
Thank you for having me.
How do the Sarasota and Venice campuses work together to strengthen pediatric emergency care across the entire system?
So the Sarasota and Venice campus work together to strengthen the care. We meet monthly with our emergency pediatric physician champion. And what we do is we discuss evidence-based practice or new initiatives that have come up, any ways or thoughts or ideas that we can improve our care. And beyond those meetings, I have Carrie on speed dial, and we are in constant communication. We're constantly sharing new thoughts, new ideas that we can do. We discuss challenging pediatric cases, but more importantly is we work together to ensure that our education is the same across the board. That way, our nurses are confident and prepared to care for a pediatric emergency at the Northport facility, Lakewood Ranch, Venice, or Sarasota.
What does it mean to you that children are not simply small adults? And how does that philosophy shape the way the team provides emergency care?
Yes, so one of the biggest mind shift sets for emergency medicine is that pediatrics are not just small adults. They have a very unique anatomy and physiology. Their emotional needs, their ways they communicate are different. Every medication we give to pediatrics is weight-based, which is different than our adult population. That is the philosophy that we go off. That's why we work so hard to educate and get that information out there that we need to be prepared to care for these patients.
So you care for children of every age, from newborns to adolescents. What are some of the different needs your teams have to be prepared to address across the different age groups even?
Every one of our ER nurses they have to have PALS, which is Pediatric Advanced Life Support. They have to obtain it and maintain it. And then we take it a step further and we require them to maintain and obtain emergency nursing pediatric course, which goes a little bit further than resuscitation from PALS, and it goes over all the illnesses and how to care for those children there. Also, we have nurses that are trained in neonatal resuscitation. So that's important when we get those newborns that come in that need the extra assistance with that. And then furthermore, which I think is just wonderful, is we have board certified pediatric emergency nurses. And that means achieving certification it's no small feat. It's time and effort. It shows their dedication and their compassion to expand their knowledge and give the best possible care to these pediatrics.
One area of focus at the Venice campus is caring for children with neurodevelopmental differences. Why can a visit to the ER be particularly challenging for children with autism or sensory processing disorders or even communication challenges?
Yes. So if you've ever been to the emergency department, you are probably aware that it can be loud, it's busy, it's sometimes stinky in there, bright, it's unpredictable. And all this can heighten anxiety and cause overstimulation. We want to meet the children where they're at. So it's important for us to recognize that if a child is pacing or covering their ears or refusing an exam, it's not necessarily that they're being uncooperative. It's that they may not know how to communicate their needs. And it's important for us to recognize that and work with the families in identifying that and give them the time.
So what tools are available at the Venice campus to help make those visits more comfortable for that group of children?
Currently, right now, we are implementing a cart, a pediatric agitation cart. And that's for those patients that are sensory seeking. So I have some fidget spinners, we have some Play-Doh or some slime for those sensory tactile children. We also have a mobile unit that we can bring into the room, and it's got visuals on it too. It's got lights, it's got a bubble machine, and those distractions can help with us moving forward. And then one other thing that I'm really, really proud of is we were able to put together a picture exchange communication system board, or a PECS board. And what this is a way for our nonverbal or verbal limited children to communicate. And something that's very special about this is that I was able to work with one of our nurses whose son used this type of communication tool in the past, and our summer intern, and we were able to brainstorm and put together this communication board that was specific to our ER.
So using that board, children are able to sort of
Yes.
point to pictures or explain without communicating verbally.
They pull it up and they put it on, and it's something that's widely used in our communities as well.
How can those resources help reduce those anxieties that those children feel and make the experience more manageable in a place like the ER, which you mentioned can be really overstimulating, even if you're not on the spectrum?
Yes.
So how do those things help these children?
So we want to adapt to them and their unique needs. It's crazy for us to expect that child to adapt to our needs and our ways. So it's something as simple as, hey, mom, dad, caretaker family, is this something that they would like? Is it a tactile thing? Do they need a movement of some sort? Can we give them something to distract them, build their confidence in us, build a trust with us? Do they need movement? I have a game that's available for movement-seeking children as well. And that sometimes helps reduce their anxiety and stress and allows us to be able to provide safer and more compassionate care.
All pediatric emergencies, regardless of the child, can be really unpredictable, which makes preparation especially important for your team. So how does the team train to be ready for those unpredictable moments that can arise?
Sure. So luckily and thankfully that pediatric emergencies are kind of low in our community hospital, but they can still happen. So for us, being prepared is key and essential to this. We do pediatric simulations, and we make this as realistic as possible, and it's a safe environment. So anybody, our team members, can join in and they can be at ease knowing that this is the opportunity to ask questions, ask clarification, to work on communication skills, work on their clinical skills, and build that confidence.
So SMH does place a strong emphasis on simulation training, and in this case, pediatric simulation training. What does that training look like, and who participates in those?
We work with other interdisciplinary teams to implement a real-life situation, so a high acuity situation that we could see at some point in time. We use all realistic medications that we have. Of course, they're fake. We use the medications. We have the same equipment. We have high fidelity pediatric dolls that we can practice our skills on. We invite whoever wants to come. We invite our Northport facility, Lakewood Ranch, we invite respiratory, anybody who might potentially be involved in this case, we invite to come in. We have students, we invite them in. We have EMTs that come around and we invite them in. So it's all inclusive. Whoever would like to come is welcomed.
How do these realistic team-based simulations improve communication and help everyone ready when a critically ill child needs that immediate care?
Right, communication is key. Across the board, communication is key. So this safe environment allows our teams to be able to delegate tasks, role clarity, that closed loop communication, they can practice on it. And then with that, it builds more confidence and that muscle memory on the closed loop communication, the delegations, and it just helps solidify that closed loop communication is so vitally important in a high stressful situation.
Now, Venice has a dedicated pediatric emergency treatment room as well. What makes that space specifically suited to caring for children?
I love this room. We have everything you can need for a pediatric emergency, from our tiny little neonate sizes up to our older older children. We have a special piece of equipment called the Pediatric Cub Crib, which is newer to our facility. And what makes this so unique is that we can weigh our small patients on it up to 4 pounds on that bed. This is different than our adult stretchers. So, for example, if you have a child that comes in and they had just broken their leg and we have them in a wheelchair, we need a weight on them. Like I'd mentioned before, everything's weight-based in children. So instead of us trying to get them up, hobble on one leg, causing more stress, more pain on it, getting a weight, putting them back, moving them back over, we can simply get them comfortable in our stretcher and weigh them right there. It also acts as a crib, so we can put up the railings and add that extra protection for our younger pediatric patients.
Pediatric emergency care is constantly evolving too. So how do you stay current on the latest guidelines, equipment, and best practices?
I am actively involved in a couple different groups. So the Florida Pediatric Readiness Group, I'm involved in a Texas Pediatric Improvement Group, and I'm involved in the Florida Emergency Medical Services Group here. And what these meetings have is they bring in the latest updates on pediatric readiness and pediatric initiatives and equipment. They offer webinars. We have pediatric experts, physicians that are giving talks on the latest on caring for a child with a fever. There's a bunch of resources out there that are free and available that we make available.
Makes a lot of sense. What do you want parents to know about pediatric emergency care available at SMH, whether it be in Venice, at the Sarasota campus, Lakewood Ranch, Northport, wherever they're going to get care?
Yeah, so as a parent myself, I strongly can relate to the stress and anxiety that seeing your child sick or injured can cause. And what I want parents to know is that we care. We genuinely want what's best for your child. And when you come to any one of our facilities, you are going to get the best compassionate care around.
Thank you so much for joining us and answering all these questions today. And thank you to Carrie as well. If you liked this episode of HealthCasts, please like and comment and visit smh.com/podcast to listen to more experts talking about the health issues which matter most to you. As always, we encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.